Just to give a quick background, William McCluskey's theory is very similar, but with different words to affect phobia therapy. Can people see the slide here that says a caregiver can be an even more effective caregiver if they actively care seek and remain regulated by another caregiver? Can you see that?
I can see that. Is there any way to press play on the...
Press play on it at the bottom, yeah, good. People
And
ask, if people want me to slow down, I can slow down as well because I have an accent. So she would think, a bit like APT, that there are 7 hardwired biological systems that we all have, which I'll talk about in a minute. But my role with Kristin, we agreed, was that I'd make comments during the breaks of a training session where someone would provide a client video or a patient video. They would then get feedback or supervision from Kristin. And I would be sitting across from Kristin in the room behind the person who's looking for feedback on their APT video. And I'd be giving Kristin non-verbal cues as to what I think might be going on from both an APT and from an attachment theory perspective. And then we talked about, and it's very similar language, looking at the vitality of a group. When people are listening to one patient's or client's story and the supervision feedback that they get from Kristin, where is the vitality? Are people going very low in their vitality or very high in their vitality? Do they need to be regulated? Does Kristin need to be regulated? So if I saw Kristin being activated, and Kristin and I got so close in working together that I could tell in a fraction of a second that she'd moved into defense, inhibition, or that she was actively present and caregiving. I think you'd attest to that, Kristin, would you?
Absolutely.
Yeah, so literally hugely attuned we became. Almost like one system, almost like a mother and baby. Like 2 carers, and my role is to support and care for Kristin as she's supporting and caring for another person. Yeah.
And Jonathan, I don't mean to interrupt, but I think it's also important for people to know that this wasn't an easy process.
No.
I mean, my own attachment issues came up to the surface during this process of receiving so much attention while I was teaching. And also being able to take in your feedback and to make adjustments in terms of like what was happening inside of me. And so, while we were focused on our patients and desensitizing their affect phobias, we were seeing our therapist activate their affect phobias. And then of course, you were seeing me as the supervisor having my own affect phobia activated. And you were the person who was, soothing and regulating me as well as the entire group. And not all people that are here, Jonathan, understand like what the training looks like. So I'm just going to describe it for 3 seconds, and then you can get back to what you're talking about. But just so you know, we're talking about a core training. It's a 3-year core training program where up to 12 students meet during a 3-day weekend 4 times a year. And how it's set up is that one student receives supervision at a time while they're surrounded by a circle of their peers watching their supervision. And the supervision would be that they would show a 20-minute segment of a psychotherapy session between them and their patient. And then they would receive feedback on their skills, but also when they started having unconscious anxiety and feelings begin to mobilize during the process, they would receive feedback on that as well. So everyone who is in the hot seat receiving supervision is under a microscope, and it's not just with their supervisor, but it's also with the co-leader, who is Jonathan Egan, and 11 of their peers. So. Yeah.
At the same time, we're using the therapist ATOS system. Do you want to talk about that, Kristin?
Sure. So we have like the therapist affect phobia study that we do with our therapist in training. And one part of that study is that we actually code our therapist when they're experiencing their consultations in order to see what is happening to them in the process. How anxious are they? How comfortable are they with affect? Are they able to notice their own defenses? How motivated are they to work through the anxiety that they're experiencing? And, what is their capacity to be connected to themselves and to be connected to their supervisor, the co-leader, or other members of the group. And so not only are they showing their 20-minute video segment of a psychotherapy session, but at the same time, they're receiving consultation and they're being coded about what their experience is during that consultation.
Yeah, and I'm putting up some of the 7 hardwired biological systems. So Una McCluskey, Dorothy Hurden Lake, Kristin Osborn, Lee McCullough. We all view it as we're biologically hardwired to respond in certain ways, and that we need our anxiety and our inhibition to be managed in order to get to our true self, to our true feelings, and to get to closeness. So when we're watching someone present, often what happens is in this internal environment, the very first piece up here, what happens is their unsupportive object relations are getting activated. And that if they react to Kristin's feedback or her responses to the supervision, often Kristin is becoming a lookalike for an internally unsupportive person in their lives who when they're growing up, they experienced, or unsupportive people. Like obviously, we can also have supportive people in our past, and we can anchor ourselves to them. But what we noticed over the 3 years of training was to manage this internally unsupportive environment, because we all know we can go in there for hours, if not days, if it gets activated. That during the COVID crisis at the moment, that the big T of COVID is activating our small T's of multiple thousands of responses which were not met or which were not adequate from our key attachment figures. Either we were let go, abandoned, or denigrated in asking for our needs to be met. And that the big T of COVID is going to activate that again. But what we noticed was, and the same happened for Kristin and I and the members of the group, was our external environment is hugely important to balance an environment internally, which has where you've received a lot of negative interactions with a supposed caregiver. That when you have experienced an internally negative, unsupportive environment, that if you go to a different country or to a conference, you have to make sure you go to a good hotel, that you eat the good food, that you have good sleep, and that after a couple of days, then go on adventure. But you really need to steady yourself, to really take care of yourself, and to activate an externally supportive environment. I said to myself, if I felt anxious during this, I would put on I'll show it to you. My grandmother, before she died, bought me what we call it is a jumper. But in Ireland, a jumper is like a cardigan. I think in Cambridge, they call it a cardigan. In Ireland, so this is what my grandmother got me. And when I wear this is an externally supportive object. And it's object that's related to my grandmother, who loved me very much and would have supported me. That when I'm talking here, I'm looking every so often at your faces, Divika's face, Barbara Christie's, Ovin's, and Julia's faces. But if I feel any kind of tremble within my corpus, I immediately go and look at Kristin's eyes for support. So not only do we access in our external environment, we need objects and things which will stabilize if we've got a creaky internal environment too, that we will balance that by having a very supportive in objects and in reminders, in symbols, and in people around us who will calm us and assuage our anxiety when we're met by the eyes of other people. And that's so much of the work we do with clients is managing things. They aren't in their body, they aren't in their corpus. They're outside looking at other people's eyes, and then their vitality goes up or down based on that. So it's very similar to affect phobia theory. The self-defense that Una McCluskey talks about is really our inhibitory system or threat system, or the anxiety pole. And she would agree with Kristin about Ledoux's model of anxiety. He wrote a really good book on anxiety. Stephen Porges' work, and Dr. Levine's work. All these kind of being overactivated and underactivated. And that, something happened there. And that but where we're poor at as therapists, and we'll see that in a moment, is we aren't so good, and therapists aren't so good at looking for care seeking themselves. And like affect phobia therapy, all emotions are goal directed. There's a direction we need to go in to get to attain relief or increase in vitality. And again, with closeness and remaining safe, care seeking is a goal-directed system that if you block, you're going to harm yourself. And what our therapists do is they do a defensive switch and they go into caregiving. And they give care more and more and more when the biological system, which is hardwired, is saying, I need care myself. I need relief, I need safety, I need to be cooed, to be calmed, and then I need a bit of advice on how to get walking again. So it's the different stages of caring. It's the assuaging and calming, the affect regulation. It's the defensive caregiver who goes in and is protective, not defensive in a defensive way, but a protective caregiver. And then there's the explorative caregiving, which we all want to do in psychotherapy, which is when we have assuaged someone's fear, we've calmed them and talked to them, we've brought them back into relationship with us, that we're relationally stable, we're both okay. Now, do you want to have a look? Are you interested in exploring that with me? Then we become a guide and a mentor and a person who explores the other system with the other person. And we feel relief if you give someone advice and you calm them and they get to their affect they've been avoiding, they feel great relief, or they feel more vitality, depending on the affect which was avoided. And maybe Kristin could talk about that.
Yeah, I mean, it's so interesting because as I look at the slide with everyone, I know that we can definitely use this for the people that we work with, but in terms of training, we definitely use it with our therapist. And, you know, as they're under this microscope and under the spotlight and experiencing a rush of anxiety, it's not just performance anxiety, it's also everything else that can happen inside. And we discovered that a lot of our therapists do need to be soothed, like externally. They needed to understand what was happening for them internally. And we always were trying to help them have what I call an open highway of give and take. Yeah. Not only are they giving to others, but they're learning how to receive from others. Mm-hmm. And so, you know, as we are working as a core training, while I would be hyper-focusing more on like the skill building aspect of learning APT or the affect phobias that are coming up for the therapist, Jonathan would really be paying attention to the attachment system and what was happening with the therapist in the moment and how we could find a way to meet their needs, but also the needs of the group, because not only was the therapist in the hot seat getting activated, but also all members of the group too.
Yeah. And that's really important what Kristin said, because if you're working in a dyad, giving care to a person who's learning how to do APT, she's not going to be able to, even if you're the best therapist, we're biologically wired when we're focusing on care to focus in on one person, which means that we're going to miss other people in the group. So it's so important to have another person there to scan the group. What Kristin does is she will focus in on the person she's working with and then pull back and do the woods from the trees and check and see what's happening. But then she'll check in with me to see if that reality was true when we have a break. The really interesting one here, interest sharing. When we are either an introvert or extrovert and we share an interest with other people, it increases their vitality. And I noticed that so much. I wasn't care seeking when the very first therapist hour occurred. But after I went to it, I felt a huge surge of vitality and closeness, the kind of two together. And that kind of brings vitality. And in a way, also with your sexual system, which is a biological system, when you share interests and curiosity with somebody else, that increases your vitality in that system too. So each system, like a jazz band, has a ripple effect through to the other parts. The good news is if you're a burnt out caregiver, is that if you see other person modeling care seeking or try a little bit of care seeking, that's going to really vamp up your if you can do it, get over the closeness phobia. The real fear I have with working with therapists, and Kristin does have too, is that people will have compartmentalized as defense. All their intimacy and closeness will occur in the therapy sessions. And then they'll go back to a devoid life of intimacy outside of the therapy hour. So it's almost like having a heart with only two chambers working. Yeah.
I think to really be sure that we were paying attention to that, we found that with training our therapists that we were asking them, how were they taking care of themselves outside of training?
Yeah.
But in the beginning, therapists would find the best deal possible on booking.com, which in Stockholm is not necessarily a good thing. And so we had to encourage them to find like safe, clean places to stay and to maybe spend a little bit more money. But also we ended each day at 6 p.m. so that people could go listen to music, go dancing, introvert and read a book, watch Netflix, have dinner together. And we were really encouraging them to either connect with one another or connect with their families or connect with themselves outside of the training day. And each morning we would start with a check-in. You know, how did your evening go? What came up for you? And at the end of each day, we would end with a check-in about what people's experiences of training was for that day. And so something to keep in mind is that, you know, the unconscious process really comes alive with these intensive weekends. And so we found that a lot of our therapists were having dreams, were being able to access feelings that they normally couldn't. And I think that was mostly because they were receiving so much support from one another and through the process. I mean, they were pushed to be able to work through their affect phobias, but they had the support that they needed in order to access feelings that were difficult for them to connect with.
You're getting me all excited now, Kristin. Yeah, I might skip forward to the video clip, will I? And give context to it. So from attachment theory, the old attachment theory, there was the strange situation test, which you all probably have seen. And we've also learned from Tronick's still face experiment. So when you're observing someone learning, you need to keep an eye on the tone of their body and how well their vitality is, how interested and curious they are, and also to keep a look at their vagal tone, which is either they're in sympathetic arousal or parasympathetic arousal. And are they going into a flop? Are they going white in the face? Are you hearing their stomach gurgle? Are you seeing their pupils change from dilation to constriction? Are people suddenly putting blankets on their legs in the room? Are they getting cold in their feet? Are they getting GI disturbance? Are they getting confused? So we're looking at this kind of change vitality. And let's have a look and see, just as a reminder for us, just a little bit of video. If I go down.
And Jonathan, while you look for that, I think it's important for people to understand that while my focus was usually on the therapist who was showing their video segment, and they have like a 7-page form that they have to fill out in order to identify like what interventions that we'll be looking at in their video segment. And while I'm focused on that person and watching, you know, their anxiety come up and thinking about, you know, how do we code them with the ATOS? Meanwhile, Jonathan was paying attention to the whole group. And so there's this group process that's happening and an individual process at the same time.
Yeah.
And the video was helpful. Yeah.
So what we're looking at in the video here is a 14-month, I think, old girl who had a terrible attachment with her mother. Her mother became very depressed, had postpartum depression, and the mother really hated her baby. And over about a year's weekly therapy here with somebody in the Tavistock clinic, she worked with developing a relationship with her daughter. But even a year later, I want you to see the hardwired response that the little girl's body has. Looking out for when we rub our eyes as a little boy or girl or as an adult, we activate the ocular vagal response, which brings on the parasympathetic branch of the nervous system. That people will put their hand to their vagus, the carotid, and rub it or protect it when they're feeling vulnerable. That people will bite their lip, that they will feel dizzy and flag when they're sitting down. But we'll see where all this develops from now.
Enters. As instructed, Zoe leaves the room without reassuring Izzy. This is stressful for Izzy and Zoe.
Hand to mouth.
Makes me want to cry. Oh. She's trying. Oh, look at her rubber eye.
Rubber eyes.
Tears are going to come now. doesn't want the stranger at all.
The stranger leaves and Zoe returns to Izzy.
So she's gone to the ground, and when our adults go to the ground, we shouldn't worry. Ferenczi wrote a lovely paper called The Wise Infant or Wise Baby. So you cannot be dropped if you're on the ground. Your caregiver cannot drop you. It's a very wise position to go to. Okay, so how do I get my here?
Hello. All right. Okay. You sit up now. There we go. Okay. All right. All right. Okay.
The arching of the back, the pulling away from the caregiver. This child does not trust her caregiver. You'll see later that the mother isn't able to assuage and calm the child. She moves away way too quickly, expecting the child to calm herself and play. You'll see this in clients when they're sitting there and you give a suggestion or talk, and they will do a shift like this in the chair, and you mightn't recognize it until you see it again. And that's where they're literally going into a kind of dismissive place of, I don't trust you. So it's where if I'm sitting here and their client, they'll like this, they'll kind of shift up, and it looks like they're adjusting themselves in the chair. But I think what's happening is they're going into what's happening here with the little Izzy.
All right. Okay. Okay. Sit on the play then.
It's normal that Izzy would be upset, but she doesn't seem reassured by having her mother back.
Oh dear. What's this?
Hard to watch.
Sit and play. There we go.
Okay, she's flagging now. Flagging. Which goes.
Okay. Okay. What's this? What's it? Oh, all right then. Okay.
Zoe's been told to return to her chair to see whether Izzy has recovered enough to play alone again. But for Izzy, her mother leaving her side is now too much to bear. It shows that although Izzy now loves her mother, she's still very vulnerable.
This is a surprise. This has been really difficult. Doesn't it, Iz? This has been really difficult.
She won't even let me put it down.
This has been so hard.
And they go back, and it's a lovely reparation happens afterwards. But could you feel in your body, my hands got wet with anxiety there. Could you feel the caregiver aspect of yourself reacting to the non-met needs of the little girl? Yeah. Did your body flinch as the child, did your mirror neurons kick in with the child, or did your mirror neurons kick in with the mother? What stance did you go into, or were you connected to both? But that caused caregiving anxiety in me. My system, the anxiety system, got activated, and I wanted to leapfrog. If I was a young trainee psychologist or therapist, I'd want to leapfrog myself into defensive caregiving. So that's the kind of stuff we're looking for in the group. This micro and quite large body movements, which are related to attachment. I'll show you some of the really interesting ones we had. Okay. Let's see. Here we go. Kristin, do you want to jump in?
Sure.
Any ones that you hone in on, or do you want me to start first of all?
Yeah, why don't you go ahead and I'll follow you through. Yeah.
So therapists and their clients can, I have to move this, I can't actually read it because my face is in the way of the words. Okay, it's changed again, is it? Okay.
Yeah, so
here's some of the non-verbals. So some of the typical things we'd look for if you're an ISTDP, which I'm not trained in, or an APT, or attachment therapy, which I'm trained in, such as holding their own arm, the therapist or the client holding their arm very tightly, and their other hand gets very red. And that's often a person who's an avoidant type of attachment style who wants to avoid expressing emotions or vulnerability, and will be in control of their emotions. Other people will do things like this, where they'll dig their nails into their thumb, or scrape their arms. And it's just a bit of data, as Kristin and I would say. But we will ask them, I wonder what you would be doing if you weren't biting your finger. if you weren't biting inside your lip, if you weren't biting your tongue, if you weren't digging your nail into your hands, what else might be happening? What else, if you spoke and told me how you're feeling instead of doing that, what would happen? So trying to activate that. Kristin, do you want to say something?
Yeah. So I mean, Jonathan and I come from different perspectives. And so for me, I'm hyper-focused on the triangle of conflict. And so if I'm sitting across from a therapist in training and we're looking at a video segment of their work, I'm going to be really paying attention to first, how are they talking about the patient? Mm-hmm. Right? What's coming up inside of them in relationship to their patient? What feelings are beginning to be mobilized inside of them in relationship to their patient? Yeah. And how much anxiety are they experiencing? And are there any defenses that are being activated? And what's the therapist's capacity to be connected with themselves and connected with the feelings that are coming up? Yeah. And so I'm on triangle of conflict, whether it's with the patient or if the therapist comes and focuses on me, what's happening inside of them in relationship to me or to the whole group. Yeah. Right. So so we're looking at what's happening in the therapist from all these multiple perspectives and multiple relationships. And meanwhile, Jonathan's really able to just take all of this information and understand it from an attachment perspective and offer a lot of support to the therapist as they're going through their consultation or as they're witnessing a consultation.
And one thing we've learned recently with Michael Alpert gave one of the Therapist Hour presentations like this, where he got us to look at our own face and to develop compassion for ourselves. And a lot of people initially report really not liking looking at their face. But one thing we noticed in training therapists, that sometimes a therapist's face will be incongruent to the needs of the client. That the therapist might have a face like this, surprise or worry, but they think it's being a congruent attunement to the client. But what we think might be going on is that the therapist actually has the face of their own mother or father, and they're not aware of it. And that's why it's so important for video work or working like this, that they can see that through very gentle exploration with them. That your face isn't really, it's showing this kind of look. I wonder what that your client might be thinking that's saying. Just you have to be very gentle with anything that and when you relate it back to the triangle of person, often these are the clients they present who have got it's a parallel process to their own unmet needs, that they're their mother or father, and the way the mother or father parented them. Do you want to say something, Kristin, on that?
Yeah. I mean, I'm wondering what it's like for people to listen because there's so many multiple perspectives to hold. And like here, what you're talking about is like, how does a therapist give to their patient, and are they representing their parent in terms of that type of caregiving? Yeah. Right. And if they are, what let's get curious about that. What's happening, because on some level that would be a disconnection from self, to be still holding, a different mask in the role of therapist. Yeah.
And it's often, and particularly when they're working with clients who've been sexually abused, the client will present the face often of the abuser when they're in orgasm or reaching orgasm, and the client doesn't know that, and the therapist might, pull away from that and withdraw and want to block that memory, which could be kind of a traumatic memory.
And so that's why, Jonathan, like when we're training our therapists, we're so focused on them being able to experience and express all feelings, and to know what does it feel like if they are having a phobic reaction or an anxious reaction in the face of difficult content or a difficult dynamic. We want our therapists to be comfortable enough that they know when something's off. And do they have the capacity to regulate their anxiety in session so that they don't become defensive unless they need to be defensive. you know,
Yes.
in terms of the work that they're doing. And I think that's an important piece to remember. Sometimes it's healthy to use our defenses when we're working as therapists.
Yeah, definitely. And the first question that Kristin asks, and it's such a simple question, what do you need from me today? And the anxiety that causes, oh my goodness, it's incredible. Because you're asking a person to go into themselves and bring out a need from themselves. You're blocking any defense to try and say, for them to try and meet your needs. And Kristin will keep going back and saying, I'm not hearing what you need here to learn with this client.
Well, and on our consultation form, you know, the first few questions are, you know, what, just like we do with our patient work, what problem would you like us to focus in on today? Like, what do you want us to focus in on when you show this 20-minute video segment? And also, what type of feedback do you want? Do you want constructive feedback, supportive feedback? Because, you know, the reason for that question is really to see how aware is the therapist in the moment in terms of what they do need under this really, you know, difficult situation that they're in.
Definitely.
So, yeah.
So when we're learning APT, for a lot of people, the school environment was or is a very anxious situation. So we need anxiety regulation there. But also a lot of therapists and our clients come from a place of having a very anxiously developed attachment style. That there's lots of, they're living in the inhibition anxiety pole. And that unless we manage that anxiety within the group, they're going to go into defense very quickly. And the key attachment defense that Bowlby talked about back in 1969, the year before I was born, he talked that the child or toddler has no option but to go into dissociation when they are not met in their fear, in their dis-ease, and when no one goes to them. So we're brought again to a place of learning, which can activate earlier people and past people in the triangle of person. And if it's not regulated in the triangle of conflict, that we will very quickly go into defense. And we know from studies that the depersonalization and dissociation defense is a lightning defense. Often you won't see a rise in inhibition or anxiety. It goes straight, zoom, if there's been early trauma, small t, in their childhood. So one of the things that Kristin and I do, and we do it naturally, is that we have the Rogerian concept of unconditional positive regard, the Irish concept of Céad Míle Fáilte, 100,000 million welcomes. That is because people who, and we know from functional MRI studies, people who are met with a neutral tone or negative tone they'll collapse. You'll become a lookalike for people in the triangle of a person.
Right. And I think, you know, something to keep in mind is that when we're working with our therapist, we are always focused on the video segment, right? On the consultation form that they filled out. We're trying to address their skills. You know, how are they doing interventions in the moment? Do they know their triangles? How are their assessment skills? But we're noticing that in that process, feelings are beginning to get mobilized in relationship to the patient, in relationship to, you know, the supervisor, or in relationship to the group, or in relationship to everyone.
Yeah.
And I think that one thing that your work has really helped me with, Jonathan, is the importance of, you know, offering people positive regard, right? Anxiety regulation, and helping people to just realistically see, oh, this is what's coming up for me as I'm doing this intensive work with emotions, and then helping them understand what they need to work through, right? And also what avenues they can take in order to do that. Yeah. And so we really, we have a huge emphasis on like peer supervision, but also we're encouraging people to go to therapy if they need to do that, to get supervision if they need to do that. But a lot of times people are able to kind of work through whatever's happening in relationship with their patients through the whole core training program.
Yeah, definitely.
Yeah,
definitely. And that's not new. That's not Kristin, that's not Osborn and Egan. In the 80s and 70s, they discovered that people doing MBAs in Harvard that when they were only 30% of them were graduating, but when they gave them a mentor who's a few years older than them who could guide them and regulate their anxiety, it went to 70% of people who graduated. So
Right.
it's adding a very simple bit of attachment. Shall I go to the next?
Yeah, and then we need to wrap up. But I think
Wow.
also one thing that we do is we strategically, we have rolling admissions in our core training so that we have our new clinicians learning from our second year clinicians, learning from our third year clinicians.
Yeah.
And there's a huge emphasis on leadership too, of like, you know, people who have moved through the program, like helping people who are new to the program, which, you know, really seems to help in terms of, you know, elevating people's motivation, especially when it gets hard.
Yeah.
So, yeah.
Because I won't show the rest of the slides, but maybe this last slide because I want to get invited back. Because we've got so much to talk about really just beyond the group. And so McCluskey, when she studied 1,000 different professional caregivers and looked at how they met their clients and how they asked, akin to Kristin, asking, what do you need from me in this supervision session, in this learning session? She discovered 5 styles of how therapists respond to their supervisor. And it's quite interesting. You always hope that the very top, number 1 therapist comes to you, who's a therapist who provides a clear account of feelings, the issues, and their concerns. And that's great. And you'll leave it increased vitality on both sides. But then you've got some therapists who will, when they're presenting a case, who will be reluctant to discuss their feelings or their issues and concerns. They want to stick to the content and that they've done really well in identifying the triangle of conflict. But what's apparent to us is that the triangular person is really more important in that one session. Then the third type of therapist brings in issues they're worried about, but then tangles Kristin up in knots when she tries to help them. It's like they present it and they go, like Spider-Man, a Spider-Man defense. It tries to help them. So, but these are obviously ways that children have learned and become adults. This is the way I get help. Then there's a therapist who brings in issues they're concerned about, but then dismisses their supervisor when they tried to help. What's called the help, reject, complain. And it can leave the supervisor feeling quite de-skilled, really, and a bit, and you feel misattuned by the supervisee as well as the supervisor. Both will leave feeling bad. Well, maybe the supervisee will feel better that they've used defensive anger. The therapist is overwhelmed in the last one, incoherent and disorganized in their presentations of feelings, conflicts, and concerns to their supervisor. The last one. And what we notice over training is that people move from this lower level, number 5, up as their defenses mature into more adaptive defenses, and that they're more able to access affect and to share and seek help from Kristin in a non trying to meet them to be good boys or girls to Kristin. They move clearer and clearer up towards the top, the therapist who provides a clear account of feelings, which is quite remarkable to watch over 3 years.
Yeah, and this is why forever and always we will have 2 people leading core trainings, because it was really helpful when you came on board, Jonathan, and with your attachment perspective, you were able to see what was happening with the group, you know, what was happening with me, and to make adjustments that were satisfying. But I'm also noticing the time, Jonathan, and we should probably stop share. Yes, it goes really, really quickly.
Yeah.
And we should take a moment. Do you have any last thing that you would like to say, Jonathan, before we move to questions and answers?
No, but I think what this community is a really good thing to do. It's really the kind, interested, and curious faces of people both meets our closeness needs as well as our shared curiosity and learning needs. It's lovely.
Well, and I know everyone's heard me say this 1,000 times at this point, but it was me reading Una McCluskey's book and really understanding the need for therapists to have external support that inspired this therapist hour, because I had already decided to incorporate it into our core training program for next year with having students meet online on a weekly basis. But when the pandemic happened, it made sense to just give this a try after the 2-day virtual conference that we had. So, thank you very much, Jonathan. And I know we don't have much time for questions and answers, but does anyone have a question? Do they want to unmute themselves? It would have to be one of those quick questions, but we'll also have the PowerPoint for you, you know, after this talk. So go ahead and ask away.
Can I don't know whether it's a question or remark. I have done several core trainings, also given core trainings. Since in the core training, people come together once every X months, in between they very often get supervision by people who have completely other style. Many clinical psychologists, at least here in Israel, they really complain about the fact that very often the supervision they get is very critical. They feel very threatened by supervision. Sometimes the supervision is given by people who can make decisions about their career. And then once every few months, they come to our training. So the question is, how do we balance, on the one hand, what they receive in their weekly supervisions, which are more frequent than once a few months core training supervision?
Well, I'm a huge advocate for having private supervision. I was so fortunate in graduate school, somebody strongly recommended that I hire my own private supervisor separate from my work environment so that I could receive the support that I needed with, you know, emotionally or learning. And so that would be my recommendation to someone, is they find someone who that they can really trust and work with, that doesn't have any ability to impact their work life. Jonathan, what do you have anything to say?
No, and I'd mirror you, Kristin. I would attend, you know, somebody for group therapy for supervision, somebody for individual therapy for supervision for kind of APT and more dynamic work. Yeah. So
Yeah.
I think you're highlighting an important thing, Jude.
Yeah, and we really hope that our therapists will find a supervisor that isn't necessarily a part of our community, someone who can really be there for you and who's invested in helping you grow. Like, everybody needs a mentor.
Yeah. And it's really interesting with children. Some children who are playing, if they are not attached to the mother or father, their quality of play and amount of play will reduce when a parent who isn't very loving to them comes into the room. The reverse happens to a child when there's a loving the parent they're attached to. They'll go over and show their mommy or daddy their what they've just drawn or what they've just made. The same happens in a learning environment. Yeah.
So any more quick question? All right. Well, I realized, Jonathan, as you were talking, this was like a huge topic for us to undertake in this 1 hour.
Yeah.
So I think people will really find it useful to receive the PowerPoint, and I'll have Lisa send that out via email, and then we'll also edit this video, and maybe even add something to it if there's anything that we feel needs more information. So how are you all doing as a group out there? Lisa's okay. Well, it has been tradition with the Therapist Hour that we end with a song. And so Lisa, have you brought a song for us today?
Hi, sure.
Hi.
I always like to share music.
Yeah.
The audio okay, the sound?
Yeah. And you just always ask us to make sure we're on mute, right?
Yeah, it doesn't, unfortunately with Zoom, it doesn't work to sing together in unison because it only allows one sound to come through at a time, and then it gets all out of time with the delay. I'll see if I can put I'll put the words in the chat so you can sing along. I've had some trouble posting stuff, so if it doesn't come through, it's a really simple song. It's the words are just, you gotta sing when the Spirit says sing. That's basically, and it's a zipper song, which means the word sing can be substituted for anything else. So if people post their ideas in the chat, we can incorporate it into the song. Sorry, I wish the lyrics would come through for you. You'll get it, it's simple. You gotta sing when the Spirit says sing. You gotta sing when the Spirit says sing. When the Spirit says sing, you gotta sing with the Spirit. Sing when the Spirit says sing. Let's do dance. You gotta dance when the Spirit says dance. You gotta dance when the Spirit says dance. When the Spirit says dance, you gotta dance with the Spirit. Dance when the Spirit says dance. You gotta rest when the Spirit says rest. You gotta rest when the Spirit says rest. When the Spirit says rest, you gotta rest with the Spirit. Rest when the Spirit says rest. Diane says play. You gotta play when the Spirit says play. You gotta play when the Spirit says play. When the Spirit says play, you gotta play with the Spirit. Play when the Spirit says play. You gotta cry when the Spirit says cry. You gotta cry when the Spirit says cry. When the Spirit says cry, you gotta cry with the Spirit. Cry when the Spirit says cry. Jonathan says hug. You gotta hug when the Spirit says hug. You gotta hug when the Spirit says hug. When the Spirit says hug, you gotta hug with the Spirit. You gotta hug when the Spirit says hug. You gotta hug when the Spirit